Yeah.
What's the response to the
Well,
Antinol?
you know, we've been doing some pilot studies with Antinol, and you know, see a lot of dogs with arthritis. We see a lot of dogs that, you know, just aren't mobile, and owners report that they're not running and jumping, and they just don't want to hop up and do the things that they normally used to do. And so we've been trying this for the past few months and been extremely happy with it. And our owners are coming back to us saying, "I need more, I need more." And you know what they report is that the dogs have a lot more energy. They just are much more willing to do things. Things that they had stopped doing, they all of a sudden started doing again. And so our goal from this now is to go to the next level and start to do some really some serious studies, some double-blind randomized studies to really show what kind of outcome you can get from this type of product.
Using it, or is it different cases?
Yeah. Well, you know, right now we're using Antinol primarily in dogs that have had injuries to their legs and have some arthritis, and that's slowed them down. And we're also looking at it as a post-operative type of anti-inflammatory. And of course, our goal is to find something that has minimal to no side effects, but still provides that anti-inflammation type of thing that we're looking for. Certainly there's lots of different medications, lots of drugs out there we can use, and they're not going to go away. They're also very, very important. But we're looking for something that we can use in dogs that might not tolerate those drugs, or something that can be used on a long-lasting basis. So maybe we use the stronger drugs initially, but then when you still have the mild inflammation, we can continue it with Antinol for the long term.
Very necessary, but what are the side effects?
Well, there's a lot of different side effects, and a lot of them, you know, as a class of drug, certainly upset the gastrointestinal tract the most. So you'll see loss of appetite is usually the first thing. You can see vomiting and diarrhea. You can see bleeding. They'll bleed into their intestinal tract. This may come out at the other end as a very black, dark stool, black tarry stool. They also have been reported to cause liver damage, cause kidney damage, and they also, it depends on the drug, can inhibit the platelets and bleeding as well.
Repair. Can you talk a little bit about that?
Yeah, the non-steroidal anti-inflammatory drugs have been shown to inhibit bone healing. So we tend to be a little careful with that when we're dealing with bones that have to heal, and we try not to use them for too long of a time, because obviously our goal is to get the bone to heal. But I will add, I think a product like Antinol is an excellent choice to use alongside of non-steroidal anti-inflammatory drugs. And in fact, a recent pilot study actually showed when used in combination with a non-steroidal anti-inflammatory drug, it actually even worked better than alone. So I think you're going to see a lot of pets that need also a drug and a supplement to get them to the highest outcome and make them more comfortable and healthy.
A long amount of time.
You know, I've used a lot of supplements in the past, and you know, the thing about the Antinol that I've been shocked by is how quickly people report that it works, and within a week to 10 days typically. And in the past, it's usually been 1 to 2 months, and certainly the results that we've seen with the Antinol in the short term far exceed what we've seen in the past.